As you know, Congress passed the Autism Cares Act in August of 2014, which I wrote to continue the research, the intervention, the support programs that existed under the old named Combating Autism Act. And while the CARES Act contains requirements that HHS conduct research into key areas impacting the autism community, chief among them is a report focused on young adults and youth with autism who are transitioning out of school-based support services into the larger community. According to the CDC data, 1 in 68 children nationally, and unfortunately 1 in 45 in my home state of New Jersey, are identified with an autism spectrum disorder. Early diagnosis and interventions have come a long way to support these children, but unfortunately youth and adults don't have the same access to support and services after they leave the school. So the happenstance of a date on a calendar changes their lives dramatically. After the law's passage, I convened a roundtable discussion with key autism community leaders in New Jersey. This issue of aging out and transitioning to community-based services was something that was consistently mentioned as an area in dire need of attention, which is exactly why I mandated this report, which would provide Congress, the agencies, researchers, and providers with a comprehensive understanding of not only what services are currently available, but what we need to do to ensure that every individual with an autism spectrum disorder can succeed in adulthood. Now, the report on young adults and transitioning youth is due to Congress this upcoming August, 2 years after the Autism Cares Act was signed into law. Can you provide us with an update on the progress of the report and confirm that it will be completed by the statutory deadline?
So first, thank you for your leadership in the space, because it's important to helping us do the work that we do. We are working in terms of this report, and I will get back in terms of the specific question you're asking on August exactly, and come back to you.
I am concerned because I understand, and my understanding may be wrong, that this has not even been started. So if that's the case, I don't know how we make the August deadline. But I hope I'm wrong, and you'll give me better news than that. But if not, then I'd like to get a sense, I'd like to give it a sense of urgency. Now, I know many of my colleagues have talked about the opioid epidemic, and of course it deserves that attention. Last year in New Jersey, heroin deaths in our state are up 160% since 2010, and we suffered more than 1,200 overdose-related deaths. So this is really an epidemic. Now, I recently held a listening session with key addiction treatment stakeholders in New Jersey to address this growing crisis, and to a person, the issue that came up most frequently, there are many, but the one that came up across the spectrum as the most substantial barrier to addiction treatment was the limitation on a provider's ability to conduct medication-assisted treatment. As you may know, these limitations cap a provider's ability to treat at most 100 patients. Now, with the number of people seeking treatment far outpacing the number of providers who can help, it seems to me that this is an outdated limitation and tying providers' hands and limiting treatment to those who need it the most. So I would certainly like to see a broader provider universe, but when something is an epidemic, you need to figure out that maybe an artificial cap at one time is now not the reality of the moment. So while I appreciate the administration's bold request for additional funds in this area and intend to be as supportive vigorously of it as I can, what can we do to increase the access to medication-assisted treatment, and what further efforts can the department take under its current authorities?
So I think that's specifically in the case of buprenorphine, that specific drug in terms of the medication and that specific type of medication-assisted treatment. And right now we are actually in the middle of changing our regulations and proposals and using as much of our administrative authority as possible to change that. And so that's something that I would expect to happen this year. With buprenorphine, as Senator Portman indicated, it is a place where the questions of diversion of it and use are the things that we want to make sure. I think we believe that we can expand those caps and move those numbers without creating that problem, but that's what we're working on right now, using our administrative authorities. I'd also reflect that as part of the budget. In the budget, there is a proposal to actually expand the ability for trained people in correct settings. In other words, making sure that beyond physicians might be able to use it, meeting certain criteria. So there are two fronts we're working on. One is within the budget. The other is administrative action we're taking where we think we can get that.
I'd appreciate if your staff would keep us abreast of how that administrative function is moving. And finally, I just want to mention, if I may, Mr. Chairman, I know my colleagues have brought it up, but I hope that your department will do everything you can to take the administrative steps that are possible within your wherewithal on the healthcare crisis in Puerto Rico. This is really I listen to these stories from people on the island, and I listen to their families in New Jersey, and it is getting way out of hand. There are other issues that they have in terms of their finances, but this is an issue that is of increasing concern, and I hope that you will see what administrative powers you have to help the people, the 3.5 million American citizens who just happen to live in Puerto Rico.
So we are very focused, and we're very focused in terms of the administrative actions we can take. Have taken a number of those in the Medicare space. I think, as you know, the Medicaid space is where large dollars and large amounts of care are very important, and it's on unequal footing. And I'm sure this committee spent time yesterday with my colleague, Secretary Liu, on important legislation that needs to occur in his area. But I would be remiss if I did not emphasize the importance of some of the help. And what we're trying to do is make sure that Americans in Puerto Rico have equitable care with regard to Medicaid in terms of those rates, and that's what the proposal in the budget. At the same time, we will do everything we can from an administrative perspective. I also think the issue that was just raised about Zika is particularly important. And when one thinks about the costs that Senator Nelson was mentioning, CDC estimates that for children who are born with some of these severe birth defects, depending on the severity, that the cost is $1 to $10 million per child. So making sure that we are doing everything we can right now to help and assist and support Puerto Rico in preventing cases of Zika in pregnant women that could in turn lead to these additional issues are a place that it's a priority focus. I think you probably heard, I've spoken to that in the past several days in terms of the urgency of the need of this financial assistance to us.
I appreciate your answers, and we are ready and willing to do whatever we can from the side of the Capitol to be helpful in your efforts there.